Good afternoon. And today we have a pleasure of interviewing Mr. Neal Hallihan. He is postural restoration provider and a personal trainer. Good afternoon, Neal.
Good afternoon.
And today we have sponsors. Our sponsors is Neurovalence Modio Sleep, drug-free solution to anxiety and insomnia. And thank you very much to our listeners. If you somebody who have trouble sleeping or sleep next to snoring partner and snoring partner might have some pain in the body, this program is gonna be for you, or you have some pain in the body, because we're gonna talk about what the holistic approach to this pain or discomfort you can incorporate in a daily routine. And if you're a medical professional who, just like us, trying to put all puzzles of sleep disorder briefing and discomfort or body symptoms associated with it and find the best solution for your patients, this program is going to be for you. We're going to talk about something what is not such a common knowledge, but can really help patients to feel better and avoid surgeries in a lot of cases. And just like usual, I'm going to talk about my the way how we met with Neal, and I would call it a destiny, because we had two times. We have a meeting two times. And the first time we met at the lecture, PRI devoted lecture in Yohi Takada clinic. He's another PRI practitioner, and Alina Connor. They all were there and had this wonderful discussion between dental and physical therapy world. And we talk about, asymmetry and all of that. And Neal stole my heart because he talked about his way of healing. And his pathway to this world is also very interesting because he was a dance coach and, did a lot of things with the movement, but he experienced a lot of things. I can read to them: neck spasm, low back pain, plantar fasciitis. For people who don't know what it is, it's a pain in the feet. And histamine intolerance, lateral pelvic tilt, tinnitus. A lot of my patients complain on that. That means it's a sound, very annoying, destroying sound in the ears, and joint dysfunctions. And he was looking for solution for himself, being that physical person who, sort of in charge of his body. He had a hard time, and that's how he found about Postural Restoration Institute. So, and because of, my passion to drug-free solution or incorporating natural healing ability, and, thank you to our sponsor who has the same philosophy, my first question to you: what realization you discover looking back at your teenager and early adult years? What was your turning point? What you start seeing all these symptoms, not as a random pattern, but as a connected pattern of tension?
That would be pretty easy. It was about 5 years into my PRI journey, because I was just taking course after course after course, and I didn't have anyone helping me, because back then it was still, Instagram wasn't really a thing. I don't think it was even there. YouTube might have been around, but it wasn't what it is now. So there was no way to find postural restoration through social media. I found it through blogs by other strength and conditioning coaches who were raving about this thing called postural restoration. So I found it through that. And then because I always knew the SI joint problems were always my biggest pain, and it would happen numerous times a year. I'd have these blowouts where I would be kind of out of commission for about 3 weeks. The plantar fasciitis, which it's not just pain in the feet, it's debilitating pain in the feet. And I had it in both feet for about 4.5 years. And it was about the most depressing thing you could ever possibly. I really couldn't move, and I was in my 20s. So I still thought most of my problems were coming from my pelvis, because in fact, I did for a long time have this obvious tilt to my pelvis. And, I knew about anterior pelvic tilt. I knew about the body structurally because I was a personal trainer at that point, and I study a lot and I read a lot. And I was reading all the physical therapy textbooks, but none of it was really working for me. I tried everything. So the whole stretching and strengthening paradigm, I was doing that. So I found postural restoration, which was the first discipline that said, you're not symmetric. That was the big part, that your right side and your left side are not the same. And that just really changed my world. Because,
for me too. For me too.
Yeah, because I saw when I was studying, before I found PRI, I would see the diaphragm, singular, and I saw this like, it's kind of attached to the spine, but it's not the same on both sides. And I kept thinking, how does that thing work? Because I didn't understand at that point in time. And then when you find postural restoration and you realize that these two sides of the diaphragm have an independence to them, so that they're effectively two different muscles and they have two different innervations, and that they influence the spine towards the right and thus the pelvis to the right, and that all our organs are asymmetrically aligned, our whole insides. And what this produces is a very typical pattern of humans that like to stay over to the right side. Once you see that, you're like, oh my God, now I see why I always see a left shoulder higher. Why when someone's squatting, their butt always shifts to the right. So I had already made those connections. But then at a course where it was another course, probably about 4 or 5 years into it, I asked the instructor about one of the techniques. I wasn't feeling anything. Well, everyone else was feeling things. I wasn't feeling anything. And she looked at my face and she said, I think you're going to need to take the head and neck course. I said, what? I thought this was all about the pelvis and the rib cage. I didn't know there was a head and neck course. And in fact, there's many of them. And then the founder of postural restoration, Ron Hureska, he used
him. Yes, his interview is very popular. A lot of people wants to know about PRI.
Yeah, he used me as an example of a cranial torsion, right? Which can certainly be found in books like this, Face to Face with the Face. It's written by an osteopathic doctor and a dentist. It's a great book. It has great illustrations. Well, if you find the picture of a right torsion, you will find my face at that point in time. I mean, spitting image. And the biggest problem was that my jaw was shifted to the right. And my canines on the right were kicked out. I had no left molar contact. And what that does is if my body shifts right and I'm just standing, I'm even more on my right side. So he used me and he had me lying on a table and everybody in the class had to come up and look at my crossbite. And he said, this crossbite is the root of this individual's pain and problems. Now it was, but it was more to it than that. So, but at that point in time, that's all anyone needs to know, that this crossbite was holding me into a pattern of right dominance and tension that there was no chance of getting out of without dental intervention through the use of a splint. So
that's fantastic story.
And just the interesting thing, because it also talks about the vestibular system.
Yes,
I was so reliant on this crossbite as a positional guidance system for this brain that's completely blind. It doesn't have access to the outside. It's trying to interpret incoming signals of light hitting your retina, incoming signals of air molecules hitting your eardrums, pressure from the ground underneath your feet. That's really all it has to go on. And it makes all these calculations and figures out, here I am. Well, that system got thrown off with me at a very young age, because you could see me at 6 or 7 years of age. My head was already like this. My left side of my head was up. I probably got expanded in that position. Well, I did. I got my teeth set in that position. And now it just locked me into a position where my body was completely shifted to the right. And my brain then had to make sense of that world. And I couldn't use both sides of my body. So when he took a little $5 mouth guard, little plastic thing, I don't think they even sell them anymore. He put it over my bottom teeth and said, okay, get up and walk around. And when I got up to take a walk, put my first foot down, it was okay. And then as I was about to take a step, my knees buckled and I almost fell down. My brain was so disoriented because he took away the crossbite, which my brain was using. But
As
then
orientation.
it got in the way of me obviously being able to do techniques to get both sides of my body back into my life. So whenever anyone has a crossbite, whether it's on the right or the left, I know that they're going to be in a state of tension, and you're not going to be able to get them out of that. You can't unlock their body if their brain has learned to rely on that crossbite for guidance, to say, here's my head, and I'm just going to keep it here because I don't know any other way of stabilizing. And it influences the neck big time.
They never taught us that in a dental school. And going back, I really like what you mentioned about, vestibular nerve, and that's what, modules kind of use to get us out of the anxiety and, help us sleep at night, a treatment for insomnia. So this is growing interest in a drug-free solution, which is PRI and dental intervention. How does it fit in a broader movement, drug-free healing, what you're talking about, and, the neurovalence solution and visual intervention. Can you, give us your look on that? And it's not only, drug-free healing is one story, sometimes surgical treatment, because lack of people looking for unicorn. Like, I want to know your opinion, what helped you to feel balanced, drug-free.
Yeah. So it comes down to the autonomic nervous system. When you have someone whose jaw is shifted, they are going to be in a state of sympathetic fight or flight overdrive. It's just how it's going to be. I'm relatively sure the trigeminal nerve is the biggest nerve that goes into the vagus nerve. So this is your ventral vagal system. This is where life happens. Anytime there's anytime there is any lack of regulation of the oral cavity, it's going to play, or the visual system, and they are tightly intertwined because they work with the head and the neck. They place you in space. Your vision and your auditory system have midlines. They are what your brain uses to figure out where is the right side of the world and where is the left side of the world. If the jaw is not positioned properly, if it's stuck, that head cannot get samples of both sides of the world because you're stuck in one position. So if in a sitting position, if I move my jaw left, my head goes right. If I move my jaw right, my head goes. Now I can sample ground underneath my right side, ground underneath my left side, the left visual world, the right visual world, distance and near. If you get stuck in one position, and now I put my weight on my left leg, but because my jaw is locked up in a crossbite, my head and neck can't alternate to the other side. And now I'm working with one side of my body, and that's the right side, because you're not going to go to the non-dominant side correctly. You're just going to stay to the right. You'll put your weight on your left leg, but your body will never actually biomechanically and sensorially, in a true way, achieve true left side position because you're not symmetrical. You're going to stay neurologically, you're going to stay right dominant, and that drives your tension levels up. Tension can go up, it's fine. It's part of life, but it has to come down. And if you only have one side of your body, you are not going through a cycle of tension and that resolution of tension. You're just staying tension, 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 tension. And once the oral cavity is involved, forget it. These people are stuck on one side of their body. And that's what's so important.
I'm going to ask you easy question and then hard question. I want you to talk, because not even every dentist knows about the role of dental mouth guard in unlocking body ability to reset and heal.
Yeah.
And why dentistry is often overlooked. I'm not talking about dentists not knowing this fact, also physical therapists, or maybe we're talking about people who do the surgery, orthopedists. They also don't think about dental pattern. Why is that? If, in PRI world, it's a common knowledge what dentistry, the dental system and vision, so connected. Like, what's your view on that? And I'm sure you see it in your daily practice. And I want to mention to our audience, Neal has a fantastic social media educational component, and he actually connects community of people out around the world who are looking for, resolution of pain in drug-free, using drug-free or physical approach or natural body resources approach. I can use several words in describing, your audience. And I was, I had the benefits or luxury actually, reading comments and even conversing with people, realize how much this part is omitted, missed.
Yeah.
Not only in the United States, but around the world, and what you're doing with your educational content. So can you give us the role of the mouth guards and why is that?
Yeah, so I think in terms of why it's so unknown, the role of the oral cavity in how the body works, it's simply because it's not taught. Everything is split up as if as if the lower body and the joints and the muscles have nothing to do with what's going on in the head. They're not thinking of it neurologically. They're thinking of it from a more muscle and bone perspective. And I think that's basically that's just how it's taught. I don't think it was a grand conspiracy. It's just how things were looked at. And now we're just trying to change that perception. But when it is known, a lot of it has come already from cranial sacral philosophies, and which comes from osteopathic medicine. And I think in the United States for a long time, osteopathic medicine was not considered truly being a doctor, even though they are doctors. They just have more training in the cranium. So a lot of these patterns that PRI is talking about in terms of, especially in the cranium, it actually comes from osteopathic medicine. But where the osteopaths didn't kind of complete the cycle was this understanding of asymmetry, and that the right side and the left side are not the same. And so asymmetry is the starting point and the end point. And those asymmetries can work their way up into that cranium and create muscular imbalances through the neck and these big SCMs that attach to the temporal bones, and they will influence the temporal bones through neck breathing. When the neck starts to get overactive, particularly on the right, because we're right dominant, we like to stay over here, and the right scalenes and the right SCM and the right upper trap all get involved in holding the head in this position to keep you straight. They can start to pull on the temporal bones, and those temporal bones shift. They move. They're fused, but not in the sense of that they don't have any movement. They do have allowable movement, as small as it may be. And that's why our jaw can shift from side to side, lateral deviation. That's why it can do it. So when someone comes in, a very typical pattern of what I see this a lot. Someone, I know they're on the right side. When I look at them, their jaw might be a little bit to the left. All right, so their midline of their mandible and the midline of their maxillary teeth are not aligned. You'll see more frequently to the left. Completely normal, because if I stay over on my right side and long enough in what we call right stance, the jaw may start to drift because of the influence of the neck musculature pulling on the TMJs. And the right temporal bone will often internally rotate. So the temporal bone go in and back, which then pushes the jaw slightly forward on the right, which then brings it slightly to the left. That's still a normal pattern. And it doesn't really worry me, because I know if I can get them to go to their left side and rotate their body in the opposite direction, that jaw may come back to center line. Yeah, you just lost two sides. But when that jaw position to the left, or the worst position is to the right, that's because now there's a derangement of, I don't want to say derangement, but a lack of, something had to go wrong for the jaw to go to the right. It's not a normal pattern at that point. And that was me. So the temporal bones really get locked up. The cranium gets locked up. The neck is locked into a forward head posture. There's no doubt. And you'll start to see canines that are protruding on one side. That's what anytime I see a right canine that's a little bit pushed out, I'm already thinking, uh-oh, not where we want to be. And when you have people like that, that's where they're generally going to need a splint, a flat-planed mouth guard, because their brain has learned to keep them in that position. It just keeps going back to it. So I could take a tongue depressor, put it between their teeth to disclude them, And now they have all this range of motion, their neck, their hips, their shoulders, because their brain finally said, oh, thank God, that threat's gone. But the problem is the moment you take the tongue depressor out and you let them tap their teeth, the brain says, oh, I know that position. Let's go back. And now they've lost all the range of motion. Now, of course, I don't know what the brain is saying. That's basically what happens. They lock up again, and they can't, there's no technique. There's no PRI exercise technique that can get them out of that position, because their brain keeps saying, no, this is I'm not going to, this malocclusion, this missing molar, this inappropriate contact is somehow a threat. Your fight or flight stays up. And when you get when your sympathetic nervous system increases, activity increases, you don't stay centered. You go to your dominant side, to the right side. That's what people have to realize. When people get limited in ranges of motion, and it shows up in testing, you don't think about it as biomechanics. Think about as nervous system regulation. When anything's not regulated, people go right because it's your dominant side, because you're asymmetric. You're never going to go to your left, not truly. It might look like somebody's a little bit to the left, but their body's still turned to the right. So that's sympathetic overdrive, and that's where left SI joint problems can often.
Yes. That's
the splint, the mouth guard, is flat on the top, so that the teeth can't lock into each other, and it is simply to reorganize their brain's sense of the body and the ground underneath them, and that's the really important part. So once you put this in, and the neck relaxes, and the shoulders, you got all this range of motion. Now you've freed up that system. They're no longer stuck on the right. They can return to a midline, to the center. And then you teach them to go left and stabilize their body. But they can't get there without the mouth guard, because the brain is using that thing, that position.
Yes, to orientation.
Yeah, for orientation, that's what it comes down to.
And my last very difficult question, you mentioned those PRI patterns. I just want you to explain for someone new, what is it? Left AIC, right BC, and right TMCC. Like even for me, for our interview, when I was preparing for this interview, I learned all these asymmetry patterns. Can you explain, and maybe for our listeners and for practitioners, they knowing about those patterns, they start connecting the dots.
Okay, so it's overall, the concept is simple. You have a dominant right side of the body because of bigger diaphragm on the right, influences the lumbar spine and the pelvis to the right, but also because of how our brain operates. The visual system and the auditory system are both biased to the right, in the sense that both hemispheres of your brain, this is the important part, this is why it's neurological, this is why it's brain and not really biomechanical. Your brain pays attention, not about seeing clearly, it pays attention with both hemispheres to the right side of your visual world. It pays attention with both hemispheres auditorily to the right side of your auditory world. Only one hemisphere, the right side, pays attention to the left. So the human organism, the human brain, is built by design, right? If you want to say design or not, it just does. Pays attention to the right side of our experience more than it does on the left side. And you'll find this in the research on split brain patients, psychiatry patients, people who have strokes in the right hemisphere. It doesn't affect things the same way. So humans are set up to be over to the right. Now, what does that practically mean? It means that you'll generally see, if this is, I'll match your orientation, so this will be your right side. What you'll generally see is a pelvis that's forward on the left as the pelvis rotates to the right, as that body shifts to the right. That's all it is. It's just a description of right dominance that's built into us physically because of the diaphragms and the asymmetry of organs. But neurologically, that's the bigger part. Neurologically, it's built into us to orient ourselves to the right. Not a problem. You have to have a dominant side. The problem is when you get so right dominant that you can't get off your right side. So you can't resolve your tension. You're no longer using your left side properly. So that's really the left AIC, right BC, right TMCC pattern. It's just a description of a human, which is all of us, that is neurologically built to orient our bodies to the right. That's it.
Got it. Got it. So thank you very much, Neal. We're going to put information about your social media channels, and I hope you're going to send me the description for the book so that people can read the books, what you mentioned, and find you and follow you on Instagram and YouTube especially. I enjoy that so much. And again, last word from our sponsors, Modus Sleep Neurovalence. If you want to find drug-free solution for your anxiety and insomnia during the day, you can move with PRI guidance like Neal described. And at night or before you go to sleep, or in case of you have a panic attack, you can use this device for 30 minutes and stimulate your autonomic nervous system, specifically vestibular nerve. So thank you very much. We really appreciate you, Neal.
My pleasure.